Scoot over. What are we talking about?
Difference between
But first we're going to
doctors
talk about.
and coaches. Welcome to the 7 o'clock talk, and tonight we're going to talk a little bit about the difference between a doctor doing functional medicine and like health coaches doing functional medicine, because we all work together for you. We actually use health coaches, we use chefs, we use all kinds of people to help educate you and get you to your highest ability or potential, let's put it that way. And so we get a lot of people, or I get a lot of questions about what's the difference between you and a health coach. And first, I'll let you start off by talking about, you actually can do all the health coaching. That's how you were trained.
Well, when I think I've used a health coach.
Oh, I've used a health coach.
Yeah, but I think people, I don't know what they think a health coach is, but most of the time a health coach is somebody that talks to you about what you're eating, how much you're eating, when you're eating, how much you're moving, and they may get into a little bit of meditation or grounding depending on how they're trained. They don't really talk to you about health, a base health,
Foundational health,
and supplementing nutrition, or how to make sure you're maximizing your nutrition with enzymes. And then a lot of people just don't know that that's what we do. So I'm a registered nurse. I've been a registered nurse for a very long time. Trevor, Dr. Miller, is a chiropractor, but he's functionally trained in functional medicine. And then I've done the A4M class, which is for longevity. So we get a lot of patients that come in and they talk about how they have visited their holistic or Amish provider. And we're not Amish, but we do holistic, functional medicine based.
So the difference between like me and a health coach, I can't prescribe, and neither can a health coach. But my ability to diagnose, and having been in the health field for 30 years, I can order labs and I know how to read labs. Not only do I know how to read labs, but I actually read labs for health coaches and other doctors.
Well, and I don't think there's any difference between us and a health coach other than we aren't available one-on-one for an extended period of time on a weekly basis. We're not gonna check in on you. You come see us. We aren't going to come see you. But that's pretty much the only difference about a health coach. Otherwise, we delve into your life as far as you let us. Well, whatever you wanted to share with us.
And not only do we delve deep into your life, but we can get into the physiology of what is going on, what is going wrong. A lot of health coaches aren't trained in supplementation and how to augment your already existing pathways to help you heal and feel the best that you can feel. And this is not, I am absolutely not knocking health coaches, because health coaches are what is needed on the day to day, because they help train you as to what you should be doing, since our environment is so bad.
They have a lot of touch points where we don't have time to do a lot of touch points for every single person. So we love our health coaches. They are our friends, and they help our patients. But
when your health coach orders blood work, number one, that blood work is generally ordered by a physician, and they get access to that. And then they have to hire somebody like me to read that blood work for them, so that they know what's going on, and then they can get into how they want to start to work with that. It's kind of funny. Most health coaches that I read blood work for, it's their own blood work, and how do they need help? How can they help themselves? I'm getting those calls almost on the daily now, where people will, through virtual clinic, will order blood work and then they need help with the interpretation. And as you look at that, the if somebody tells you your blood work looks normal and they say everything's within ranges,
who's reading it?
And they don't look at an optimal range as compared to a normal range, and this kind of ties into some videos that we've done in the past, which we talk about there is a difference between optimal blood work and what is viewed medically as normal. Normal is just going to keep you alive. It just means that you're not quite broken yet. But then
You are normal for a sick population.
Yeah.
That's a good way to think of it. When you think about healthcare, which I say sick care, it is based on a sick population, not a optimally well population.
And so a lot of functional medicine doctors are going back and looking at like our World War II veterans blood work when they first went in, because that was pre-industrial revolution of the food medicine of the foods. And so they were typically seen as a very healthy cohort that we can get numbers off of. But like your liver enzymes, just one instance, your liver enzymes back then, normal was less than 20, and now normal is less than 40. And so there's a whole lot of dysfunction that is happening between there. Another thing is a lot of even medical doctors don't read or even do an insulin to see how somebody is progressing in their trek towards diabetes. Because if you eat a standard American diet, you are firmly on the road to diabetes or some sort of chronic illness and disease.
That is inflammation based. All chronic disease is based on toxicity and inflammation, imbalances.
And so, that's a difference between me and even a medical doctor. And it's not that this is something, we're not better than these people. We're just different. And we read things and we look at things differently than they do. And our experience is different.
And most people find us after they've exhausted their primary care in the specialty field of the allopathic world.
Well, that's just like chiropractic. The funny thing about chiropractic is chiropractic is usually, it's in this area, a last resort. So people will come to me as a chiropractor because they've been everywhere and they're looking at, oh my goodness, I got to go get back surgery and I don't want back surgery. And so then it's okay, well, here's what we're going to do, and let's give it, 6 visits and see how you're doing. And if you're progressing, great, we will continue on. If you're not progressing, then we're going to get you to some place, or maybe you do actually need the surgery. And so those are the things that we look at that make us different. Your health coaches and all of those types of healthcare providers, they don't necessarily have the ability to order labs. They don't necessarily have the ability to actually read the labs. And then you have to depend on somebody like me or another type of doctor to read the labs. And when you're talking about functional medicine labs, a lot of medical doctors have no idea what they are. They won't order them. They won't touch them. They don't believe in them. And I still, to this day, don't see how they can't believe in them when you can do a pre-lab and then do a post-lab and the patient's feeling better and you can show objective data that they're doing.
But I don't think they have the time to do that. One, they don't understand the lab. They don't know how to read it. They don't know how to do something with it. And then they don't have the follow through. But I was going to say something else.
But I love labs. I love digging into labs, and you get a lot of information. And I'm the type of person also that you have to show me.
Well, and we've just learned don't guess, test. Like
Oh
we
God,
we
yeah.
don't
It
we
saves a
don't
lot of
whack a
money.
mole. We aren't going to sit here and guess. If you have specific symptoms that are totally blatant, great. But we will treat you to a certain point, or you do your own work and to a certain point, and then when you can't progress, come see us.
And that's like the Thrive in 63 program. That is a great health coach in a box where you can start that program. And as you start that program, what it allows you to do is you clean up the diet, you start to feel better, you start to digest your food, and then you can come to somebody like me where you've focused the picture.
And that's 9 weeks. That Thrive in 63 is 3 phases over 9 weeks. It will change your life in 3 days.
Well, start to
Three
change your life.
days. I guarantee you in 3 days you will feel much better than you did on day one.
Well, they guarantee it because they guarantee it
Yeah.
in 30 days. So will that eliminate chronic disease?
No,
No.
but you're on the path to feeling a lot better.
You at that point in time, at the end of 63 days, you have taken your nutrition to a new level that allows your body to heal. Then we can come in with testing and we can start to help the pathways that are damaged repair. Because if you're not digesting your food, then you're never going to get better
Well, if you
because you
can't
don't have the
digest your food,
gas.
you can't digest the supplements. So after you've went through your 63 days, then we will take another look if you're having problems, because we have access to high quality supplements, different testing. We have a bag of tricks. We have the chiropractor, the acupuncturist. We can do cupping, strapping. We can do
Shockwave,
shockwave. We have the
acupuncture.
ability to help you feel better quickly.
And so that's what we're all about. How can we use the tools that are at our disposal to get you feeling better the fastest you can? And that is one of the differences between us and medical doctors and us and health coaches and us and basically anybody else, other chiropractors that are around. We have expanded our tools so that we can help you as quickly and efficiently as we can. And I say quickly depends on your body. The longer you ignore the signs and symptoms that you have a problem, the more damage is done and the longer it takes to reverse it. So I was just talking to a patient today at 54, no medications, no high blood pressure. I work out a couple times a week. So, I'm not in there just killing it in the gym. And I am healthy for a 54-year-old. Most 54-year-olds that we see and hear, and you got to remember, as a doctor, the people that come in to see me are already sick. And so when we see them, they're coming in on 12 medications already. I look at these people that are younger than me in their 30s on these things, and it is absolutely astounding. And I didn't start that way. I didn't start to try to figure this out until I was in my late 30s, early 40s. And then I was 300 pounds or just about, and I was systolically hypertensive, and I was trying to out exercise a horrible lifestyle. And you just can't do that.
Well, and remember, food is medicine.
Yep.
Food was the original medicine. Your doctor was a teacher of herbs and food, honeys,
Yep.
bark. Those are your original medicines, and we have just taken those and created synthetic versions of them that aren't necessarily better and come with a whole lot of side effects.
And I would say I have two things to close. One thing is, when you eat, there's nothing else you're going to do in your life or lifetime that will subject your body to more toxins and more immune activating things than what you eat, because you're going to eat literal tons and tons of food, and just the simple fact of eating causes the release of lipopolysaccharides, which start an inflammatory cascade. So where is your gut in healing? How is it doing in the ability to heal and protect you? Because that is the first line of defense.
Well, and if you're going to take the time out of your day to make the food and then sit down and eat the food, make sure that it's beautiful food, one, and it's the healthiest food that you can put on your plate.
And lastly, our environment in America, here especially in the Midwest, the environment is not conducive to health. So you need to learn, and this is where a health coach is great. Work with one. You need to learn what's good, what's not, and how to maximize your health and well-being. And they can do that with simple teaching. And then you come into somebody like us, and we start to take the broken parts and giving them the support they need to heal. The body will heal itself. So,
Well, and get a health coach that fits your needs. There's a gamut.
oh yeah.
Make sure you can connect with them. But if you don't have the ability or the time to do that, then start simple. Get high quality food, get out in nature, connect with nature. And when you connect with nature, you connect with yourself. And move.
And good, the 5 pillars to health. Sleep's number 1, nutrition, movement, stress, community. Those are what you have to work on. Very simple in context, very simple, but not necessarily easy to pull off. Sometimes you have to let some people go that you don't want to. And that's just the way that it is, depending on how healthy you want to be. So, with that being said, we're here to help you heal from the inside out. And we will, yes.
If you have any questions on anything that we do, the Thrive in 63 is fabulous. You can call us at 812-346-1757. You can email us. I'm mrsindianabackdoc@gmail.com. And this is Dr. Miller at
integratedhealthofindiana.com. Also, if you're interested and you're shy, you don't want to reach out, you don't want to call, go to integratedhealthofindiana.com and go to the product page. And if you scroll down, the Thrive in 63 is there. It's just a click away, and that'll help you get started. And with that being said, yep, we're here to help you heal from the inside out, and we'll see you next time.